I wanted her to continue to talk to get more time from my side.
What?
I wanted her to continue so I'd have more time.
No, we're trying to keep it 5 minutes. We'll get a second round. Everybody will get a second round.
Republican jokes aren't funny. I'm sorry. I apologize. Thank you, Mr. Chairman.
Republican jokes aren't funny.
Southern drawl. Anyways, let's get back to the topic here. Ms. Tavenner, thank you very much for being here. We are now more than 30 days into one of the greatest website disasters in history. After nearly $400 million, healthcare.gov is synonymous now with failure. The public's trust has been broken, and the reports I'm hearing reinforces why. One in particular, we've already heard discussion on this case of the South Carolina man, is so painful that I want to dedicate my time and my questions to trying to resolve his issues. The case starts with Justin Hadley from North Carolina attempting on October the 1st to get Obamacare through the healthcare.gov. By Halloween, just 4 or 5 days ago, he was still unable to sign up for Obamacare. However, Mr. Hadley from North Carolina immediately saw 2 download links. The linked document was an eligibility notice to Mr. Dougal from South Carolina, including Mr. Dougal's name, his address, and his eligibility for subsidies. Mr. Dougal is now requesting that the personal information for all of his family be removed from healthcare.gov because he could not remove it himself because there's no delete option for consumers. Of course, now Mr. Dougal nor Mr. Hadley will use the website to purchase insurance. Making matters worse, when my office was contacted for assistance, we called the healthcare.gov's 800 number as well, and we asked a very specific question. Can you remove Mr. Dougal's personal information? The response was silence. Not a yes, not a no, not a maybe, not let me check with my supervisor. They just simply refused to have an audible word in response to our question. It's hard to believe that your account managers really do not know if they can delete accounts internally, especially after such an egregious breach of trust. By the way, Mr. Dougal has called on several occasions, but no one will call him back. Not a single person has taken the time, after having his information exposed, to even call Mr. Dougal back. I tell you this story because it illustrates what happened as a result of incompetence with this website and this program. The administration and HHS knew that Americans' personal information was at risk before the website went up. I think Senator Roberts just spoke about the Inspector General's report from August that warned that Obamacare's exchanges may end up illegally exposing Americans' private records to hackers and criminals. The report noted that CMS is working with a very tight deadline to ensure that security measures for the hub are assessed, tested, and implemented. Further, Senator Roberts alluded to the internal memo from September 27th obtained by Washington Post. And to quote that memo, it says, "Inherent security risks expose a level of uncertainty that can be deemed as a high risk to personal financial information being exposed." The memo was, of course, as you have taken responsibility, and we do appreciate that, was written specifically to you from your consortium administrator for health plan operations and the deputy CIO. You signed the authority for healthcare.gov to operate for the next 6 months with a mitigation plan to be implemented. In other words, you authorized healthcare.gov to go forward, realizing that the potential of exposing personal information was, and I quote from the memo, a high risk. Here are my questions. Do you believe that 6 months is an acceptable amount of time for this website to operate in a manner that puts Americans' financial information at high risk for security breach? Has this happened before? Can you guarantee that Social Security numbers, and it seems like you've addressed this, are secure? Will you shut down the website, as my friends from the left have already suggested, until security issues are fixed? I would also like to finish by asking that we get Mr. Dougal an answer as it relates to deleting his information from the system, and that we get that answer today if possible. I have a copy of the letter that he is requesting, and I would like for Catherine to bring the information over to your staffer as well. And I certainly realize at the beginning of this testimony, the answer was given that the software fix has happened on this information, but the software fix was simply to disable the links. So when Mr. Hadley goes back on the website, he still sees the links. He simply cannot click the links. So the guarantee or the clarification or the resolution that simply tells Mr. Dougal that he has complete confidence that his information has been deleted from the system has yet not been achieved.
So first of all, Senator Scott, we have reached out to Mr. Dougal several times, and we will find him and we will follow up on his question.
I'm happy to give you his phone numbers.
I think we have them. Thank you, though.
He doesn't think so, actually, because no one's called him.
Well, we have disagreement there.
Yes, ma'am.
Your second question about the hub is the hub was, and this is, I keep trying to separate the two because they are two different systems. The hub was completely tested all the way through, and there was a sign-off by the Chief Information Officer, so we should put the hub aside. What we're actually talking about is the FFM, or the exchange piece, and that's the part that I described. And in the 6-month period, let me tell you what's going on at that site. There's a dedicated security team that works under the Chief Information Officer. We do weekly testing of all border devices, including internet-facing web servers. We do daily, weekly, 24/7 continuous scans. We will have a full SSA test in a stable environment with all the security controls once the software upgrade is done, and that's standard operating procedure. And that will be within 60 to 90 days of us going live on October 1.
My only response, and my time is up, thank you very much for your answers. I would only suggest that whether it's the hub or the other entity, the thing that the consumer sees is not what's going wrong, it's that their confidence is going down, and we're only trying to make sure that we alert y'all to the fact that if any aspect of it doesn't work, then the confidence is gone. Thank you, Senator.
Senator Scott, I wonder if you would also make that what you gave her available to the minority and majority staff directors
Yes, sir.
of the committee. I'd appreciate that.
Yes, sir.
Thank you. Thank you.